Welcome! This video aims to give you the most important information about therapeutic hypnosis so that you can be as prepared as possible for your first session. You may have questions or fears about hypnosis, and that is normal. Please watch this video entirely. If you have any questions, you can pause the video and write them down. We can discuss them afterwards. I am Marie Bovet. I first did a bachelor in nutrition and dietetics in Geneva. Then I wanted to learn more about human functioning, and so I completed a master's degree in psychology while working as a dietitian in an independent practice. Passionate about hypnosis for several years, I completed my training with a certification in Elmanian hypnosis. I am Julie Bovet, a registered dietitian in Geneva. Passionate about nutrition and the human body, I have worked in various healthcare structures such as hospitals, private clinics, and medical practices. I love to dance and want to accompany people with even more efficient techniques. Dance and movement therapy, as well as Elmanian hypnosis, are the tools I have chosen. What is hypnosis? Hypnosis is a natural altered state of consciousness. It is an ancient technique used for healing in Western societies for at least 200 years. Scientists have worked hard to demystify hypnosis to show that it is not magic, witchcraft, or shamanism, but a capacity that we all have within us to make our brain work in a different way to heal ourselves. In the state of hypnosis, our imagination is activated and is much more present than usual. The brain does not distinguish between imagination and reality, which has been proven with MRI studies. The brain of the person in hypnosis who is asked to recall a memory as accurately as possible is activated as if he or she was actually seeing, moving, smelling, and touching. It has been found that the brain waves generated in hypnosis are different from those in the waking state. They are called theta waves and are related to the functioning of our subconscious mind. Who can experience the hypnotic state? Anyone can reach the hypnotic state more or less quickly. We all experience this hypnotic trance on a daily basis, mostly without noticing it, for about 20 minutes a day. For example, when we are driving from point A to point B and we are absorbed in our thoughts, we don't even notice where we are going. It also happens to us when we are engrossed in a good book or watching the landscape behind a window. We are either receptive to hypnosis or very receptive. When a trusting therapist client relationship is well established, most people can benefit from hypnosis therapy. People with severe psychiatric disorders, schizophrenia, psychotic episodes, inability to concentrate, should not use hypnosis. What does it look like to be in hypnosis? The hypnotic state lies between our usual waking state and sleep. During the hypnosis session, you can move, assume a more comfortable position, or talk. You may experience that you can no longer feel one or more parts of your body. Thoughts and critical thinking are always present. None of this will bring you out of the hypnotic state. You can decide to follow the suggestions or not. You may miss some of what is being said, and that is normal. In a state of hypnosis, one tends to lose track of time. It's a state of mental disconnection from our surroundings and a hyperconnection with our inner world. The deeper the hypnosis, the more our conscious part and our creativity are awake and our five senses highly developed. Are there Different forms of hypnosis. There is only one form, self-hypnosis. It is therefore your choice to enter that state and to remain in it during the session. As therapists, our role is to provide a safe framework to guide you to reach the state of hypnosis. Our suggestions make the process easier. In short, we help you to bring out your resources to heal yourself. Can I lose control? No one can control you. In fact, you are the one who is doing it. Your conscious part is careful to protect you and will not accept suggestions you don't like. It is impossible to be hypnotized against one's will or to do something that goes against one's values. This is very far from the image of the subject being directed by the hypnotist as seen in the shows. Is it possible to get stuck in a state of hypnosis? No. If you want to emerge, you can do it at any time simply by thinking of it and opening your eyes. At any time, you can stop the session. What should I expect during my first hypnosis session? We will first discuss the problems that brings you here, then your knowledge of hypnosis, and your questions and possible apprehensions. Only the voice is used to guide you. You will close your eyes, and we will suggest that you enter a relaxed state, facilitating the process. How to make a hypnosis session a success. The therapy can work best when you are confident, when you do not judge the experience, and when you are fully involved in it. Of course, the critical mind is always activated, but these thoughts do not hinder the therapy. If you still have fears or misunderstandings about hypnosis, smaller therapeutic changes can take place. I have a lot of willpower, but I can't change. I have understood where the problem comes from, but that has not made it go away. I feel stuck. Can hypnosis help me? The will to change remains in the conscious part of our mind, and we have all experienced it. At some point, this will weaken and our old habits take over. Just as understanding the reason for the problem is not always enough to get better. When we feel stuck or unhappy in our lives, it's often related to the fact that some of our core beliefs and or habits have not evolved for a long time. The hypnotic state allows access to the subconscious part where habits, beliefs, emotions, resources, and all our memories are stored. It's in the subconscious that the transformation will take place at a deeper level, which will allow sustainable changes in the long term. It is therefore possible to change habits or thought patterns that are no longer useful in your current life. How many sessions do I need to treat my problem? Everything is possible in one session. Sometimes one session is enough, sometimes several are necessary. We support you as quickly as possible in your goals for change. For what situations is hypnosis helpful? The hypnotic state allows for great changes even in the deep structure of the brain. Hypnosis sessions are indicated for many situations: weight issues, eating disorders, metabolic diseases, mental suffering, managing emotions, self-image, poor health, personal development. Goals of hypnotherapy. More generally, hypnotherapy aims to revive your resources, reharmonize your internal balance in order to be in tune with yourself, activate your inner doctor, take back control of your life, calm the fear of abandonment, and make yourself secure. What if I have a physical problem? It is clearly recommended to seek medical advice for physical symptoms before starting a follow-up. If the cause of the problem is purely physical, traditional medicine is necessary. Hypnosis and self-hypnosis can help with pain management or improving mobility. In many cases, the cause of a physical problem is actually psychological, and in this case, hypnosis will help to get to the cause. The body can actually be healed by the mind. Are there any side effects after a hypnosis session? No, this natural method has no negative side effects and is safe. The hypnotized person is observed to have a slight feeling of being in cotton wool immediately after emerging, which dissipates within 5 to 15 minutes. When will I see positive changes? A positive impact on thoughts, emotions, behaviors, and perceptions in everyday life can be almost immediate, but can also take some time. Self-hypnosis helps to consolidate the work done in session. If you would like to learn self-hypnosis, please let us know during our face-to-face meeting. Closing words. What has been provoked with words can also be solved with words. We have everything we need inside us to overcome our problems. We are not responsible for what we have been given, but we are responsible for what we do with it. We can choose to say stop to the influence of our past. Before your first session, please prepare your answers to the following questions. Do you have any fears? Do you have any misunderstandings? And any other questions? Thank you for your attention.